And today we have with us Emily Byrne from JFO. So introduce yourself because we never get to meet you.
Sure.
So
Yeah. That should be better.
First.
Is that all right?
No.
Better? Yeah. Okay. Sorry about that. So I'm Emily Byrne, the Deputy Fiscal Officer from the Joint Fiscal Office. Yeah, I don't get to be here anymore. I was in a former life when I worked for finance and management. I spent a lot of time in this room when it was appropriation. It's fun to be back in here. But so I put together a presentation on the budget adjustment. That's really not like what's in the actual budget adjustment, but like why is there a budget adjustment and what does it do and why do we go through this process every year? That I've presented in a couple different committees. And the chair asked me to come in and present it here, so I will walk through that with you and stop me at any time if you have questions. Let me share my screen. I have to do 3 presentations today on 3 different things, and this looks like the right one. Okay, good. So the Budget Adjustment Act. We'll go through an overview of the process and a little bit more just about the bill generally. So the first thing to sort of think about before we even dive into the budget adjustment is the timeline for building the actual budget. So if we sort of work backwards. So on May 23rd of 2024, the governor signed the fiscal year 2025 budget into law, which is about six weeks prior to the actual start of the FY 2025 budget. If we back up even further, the governor presented that budget to the General Assembly back on January 23rd of 2024. We go back even further, the executive branch started building that budget on August 31st of 2023, which is about 18 months prior to the actual start of that budget year. In August is when budget instructions get issued to the agencies and departments, and they start sort of pulling together their projections for the next fiscal year. I think it's important to think about, right? Things change over time, right? That's a really long time to start a budget process. And that, and then you've got another 12 months of the actual budget itself that's going on. And right, I always had to remind people that the budget is just a plan, right? It doesn't mean that we're exactly going to do anything that's said in the budget, but it's our best sort of estimate on how we anticipate we're going to spend the estimated revenues that are available within a given fiscal year. And there's a lot of assumptions that have to go into that, right? I've been working on building the state budget for over 10 years. And, we're sort of like weathermen, right? Like we have a lot of data. We make the best estimate that we can, or the best, I don't like to say guess, but on some level, it's really, try to figure out with the best information possible, what we think is going to happen in the next fiscal year to try to create that plan. So when things change, right? So those of you who've been around for a long time or know, this is Tom Cavett and Jeff Carr. They do the revenue forecast for the state. So we have to think about things changing on both the revenue and the expenditure side. So on the revenue side of the equation, the General Assembly and the governor, sort of the budget that was adopted for FY25 was based on a revenue forecast that was adopted in January of 2024. The emergency board, and that was the revenue structure that went into effect when the budget was passed. The emergency board met again on July 31st of 2024, and they adopted a new revenue forecast, which included a change in the anticipated revenue available in the current fiscal year. And this year it was sort of a significant change in general fund. They assumed that there would be another $172 million collected by the state in fiscal 2025, which is a pretty significant revenue upgrade for the state. But that money is anticipated to be available in tax receipts in the current fiscal year, and available for appropriation or reallocation in the 2025 Budget Adjustment Act. And of course, so we have that sort of pillar or, goalpost or whatever from last July, but they were going to meet next week, or no, tomorrow. It's already tomorrow.
Easy.
Yes. Can you remind us who's on the emergency board?
So yes, the emergency board is the governor. He's the chair of the emergency board, and then the 4 money chairs. And the money chairs are the chairs of House Appropriations, Senate Appropriations, House Ways and Means, and Senate Finance. And so they will meet again tomorrow and adopt yet another revenue forecast. And the revenue could go either direction, right? Luckily, this year, there's more revenue available, and we're not in a situation I had talked about being in this room 10 years ago. 10 years ago, when we were in this room, we were talking about, revenue downgrades of $100 million at the time, right? And adjusting the budget, cutting stuff out of the budget to bring it back in line with that adopted revenue forecast. So we'll learn more tomorrow about whether or not there's more or less revenue available than was assumed in July. In addition to the general fund, we talk a lot mostly about the general fund and the Budget Adjustment Act, but they're also going to adopt new forecasts for the transportation fund and the education fund. In addition, there are lots of special funds across state government, I think over 400 of them. And you just, when you get to the middle of the year, you just have more experience generally with revenues in all your funds, not just the big ones. And you have to make adjustments accordingly based on whether or not receipts are coming in or not. The example that I use from the current budget adjustment is there was assumptions made about how much revenue would be collected from sports wagering. And I think there was a news article about it last week. And it turns out that we are not collecting as much money as we anticipated from sports betting. So we have to make an adjustment in the Budget Adjustment Act to deal with reduced revenue collections and sort of backfill those receipts with different revenues. So that's the revenue side. The other side is on the expense side. So we build the budget assuming a lot of things, right? We assume certain caseload and enrollment projections in different benefit programs. For this committee, right, we assumed that a certain number of people would show up for Medicaid and they would utilize Medicaid at a certain rate. We have to do things like assume how much it might snow in a given year, the Agency of Transportation, right? How much salt do you need to buy based on how much we think it's going to snow, and how much overtime do you need to budget for folks that are going to drive plows? I mentioned Medicaid as sort of a utilization one, but I'll say it again, like how many people are actually going to show up at the doctor that are enrolled in Medicaid, and how is that going to impact spending? We have to assume whether or not there's going to be a flood in the budget and plan for it accordingly. We have to try to make our best guess about what's going to happen in the economy, right? There's a lot of uncertainty in terms of what's sort of coming down the pipe. There's assumptions about the price of gas that are built into the budget, right? For places like the Department of Public Safety that have a lot of, that have troopers that are on the road, or the Department of Fish and Wildlife, Agency of Transportation, et cetera. Cost of state employee benefits, right? There's changes in what we think the healthcare cost, for example, for state employees is going to cost on an annual basis. You have to adjust based on those things. There's assumptions about the rate of inflation and what's going to happen to the rate of inflation over the 12-month period that the budget reflects. And it keeps going on, right? There's all of these assumptions in there. And right, it turns out sometimes you're wrong when you pick those assumptions, when you build a budget, right? More or fewer people enrolled in those programs. We're seeing that in Medicaid. Or we're seeing in Medicaid that, right, the enrollment is about correct. It's the utilization that's up, right? It's going to snow more or less than we thought it was going to snow. More or fewer people are going to utilize the services that government provides. There was a flood last year. We did not budget for there to be a flood this year, and there was one. So now we have to deal with it. Something happened in the economy, right? Employment was up or down, inflation was up or down, et cetera. The price of gas was different than what we assumed. The employee healthcare costs went up more or less than was anticipated. In this case, it went up more than we anticipated. The rate of inflation was different than what we assumed. Right, we kind of keep going with all of those expenditures. And there's so in the Budget Adjustment Act, right, we're adjusting for all of those things, all of those assumptions that we thought once we have more and better data and more information, we can tweak things to make sure that our spending aligns more with what's actually going to happen. Or that I should say that differently. The General Assembly is adjusting the spending authority that's available to the executive branch based on those projections. So there's lots of other things that you may hear about in the budget adjustment, both when you have agencies and departments that come in to sort of tell you about their budget adjustments, and also when you hear about it on the floor when the Appropriation Committee presents it. But there are things where receipts aren't meeting projections, right? This is the sports betting issue that I brought up, that money's just not coming in and we have to adjust accordingly. The cost per case is increasing or decreasing, right? This is when you get into the Medicaid PMPMs are higher than we thought they were going to be. Projections were not met, right? We thought there was going to be savings somewhere in the budget. We thought there was going to be some sort of additional expenditures in the budget, and that's not coming in. Unable to hire staff. So sometimes you hear this in agencies and departments where we've wanted to set up a new program and we say, you got to go out and hire people, and they're not able to hire those people. So they have to adjust their budget. They have savings in their budget potentially because they weren't able to hire the staff to do it, or they weren't able to get the program off the ground because they don't have the people to do the work. to get the program going. Projects started late. Often we make assumptions about when an agency or department will be able to get something moving. And then, say 25 days after the budget starts, there's a flood and the Agency of Natural Resources has to redivert all of its resources to deal with the flood emergency as opposed to working on the new project. Savings weren't realized, right? Sometimes we make assumptions about, if we do something differently or if we reallocate resources, maybe there'll be some savings in a program, and sometimes it doesn't happen. Oftentimes there's an assumption about RFP is a request for proposal, right? You ask a third-party contractor or some other entity to help with a project, and the cost of that request for proposal are lower or higher than what you anticipated in the budget. And in order to keep that program moving forward, you may need a budget adjustment to sort of increase funds available, or the proposals came in lower and maybe you actually have some savings to sort of give back to the general fund. There are also lots of net neutral transactions. So we try to do our best to make sure that we put the appropriations in the right line item of the budget. Sometimes we get them wrong. Sometimes the agencies and departments after the fact are like, that should have been in this part of Medicaid instead of, this part of Medicaid, and we have to move things around accordingly. You may have heard this from some of the AHS departments, but the SLA agreement changed. That's the service level agreement that agencies and departments have with the Agency of Digital Services in terms of how they buy IT and how they reimburse ADS for costs that they incur. In the budget adjustment this year, and particularly in the Agency of Human Services, there are a lot of cost pressures associated with those technology purchases.
Service
level agreement. Yeah.
Thank you.
And I realize now that it's redundant because it says agreement twice, but I've only given this 4 times and I just noticed that one.
In budget adjustment this year, particularly in AHS, there is a lot of that.
Yes.
So why would something like that not have been anticipated last year when we did the budget? Isn't it a fixed price essentially?
Sometimes that's a great question for the department, I think, or AHS in general. A lot of times those service level agreements are on a reimbursement basis. So it may be things that they purchased in prior years and the prices are just different, or they assumed a certain cost for certain IT things. And a lot of times the SLA is typically stuff that's like one-off, or like they're doing a new IT project kind of thing. And ADS does all the procurement and then charges it back to departments.
And the Agency of Digital Services is funded essentially by all the other.
Yes.
Okay.
By the rest of state government. And that's a sort of budgetary mechanism to make sure that we can get the federal government to kick in to sort of their fair share.
Okay.
Is why it's overly complicated, but that's the sort of, and special funds, right? So it's not just the general fund paying for IT, it's sort of a way to share the burden across all the resources to the state. Another one sometimes we'll see, and it's not really in this committee's jurisdiction, but the Human Rights Commission is an area where they've assumed some vacancy savings in their budget. So they assume they'd have some positions that were open during fiscal year 2025, and they haven't had those positions, which means they need some more money in the budget to make sure that they have enough resources to pay all of their staff for the full fiscal year. So enter the Budget Adjustment Act. It's frequently referred to as the BAA, even though it technically isn't an act until it gets to the end of the process. But the second A is for act. And the Budget Adjustment Act, right? It's just the mid-year fiscal opportunity to make updates to the current budget, a chance to both appropriate unforeseen revenue or sometimes cut revenue decreases, and address unplanned expenses or capture unplanned savings. It's really meant to be a technical adjustment to the appropriations based on new information. Typically, we don't see policy in the Budget Adjustment Act. It's really just supposed to be updating financial projections based on new information. One thing to note is it doesn't change the base budget. So there has been, when we build the FY26 budget, the starting place is going to be the FY25 budget, not the budget adjusted FY25 budget, which is sort of an important nuance. I think some people, sometimes it's confusing where there's, a Medicaid caseload is a great example, right? In the Budget Adjustment Act, there's a big change in Medicaid caseload. The spending for Medicaid caseload That will sort of repeat itself in the 26 budget. So you'll see an up, right? They talk about the ups and downs. You'll see an up in the budget adjustment, and then that up will happen again in FY 26, assuming that those caseload and utilization numbers sort of roll forward into 26, and per the consensus process, they will. But it's not we don't adjust the budget and then base the next budget off the adjusted budget. It's based off of the as passed version. Is an important nuance. And sometimes things that happen in the base budget will happen again in the next budget. Sometimes things that are happening in the budget adjustment are just one-time adjustments in that budget adjustment year. A lot of times it outlines, incorporates changes outlined in the letter of intent. So the budget's not always perfect, right? There's lots of opportunities to make sure we get things right, passes the House, opportunities to fix stuff in the Senate, and then again in the conference committee, but sometimes, the details aren't exactly clear when the administration gets the bill, and they ask the appropriations chairs to issue a letter of intent to address some issues and provide some specific guidance to the administration. And these should be links to the letter of intent, which I'm happy to walk them through.
They're not live.
They're not live. All right. Oh, and they told me that last week. I need to fix that. Get it back to everybody.
You're not the only one.
So anyway, the letters of intent, right, give that sort of guidance on things. I can pull them up. There's one on substance use that might be relevant for this committee, but a lot of it is related to Act 181. But anyway, I can go through those at the end if you want me to.
That'd be great.
Sure. So the timeline for the Budget Adjustment Act, it's typically presented very early in the legislative process because it impacts spending that's happening today. It was presented on, I think, the third day of the legislative session, 2 Fridays ago, to the House Appropriations Committees or Committee. It's typically one of the first bills that passes the General Assembly, usually not long after town meeting day. Sometimes before town meeting day, sort of depends on what's going on. It's not the last time that the General Assembly adjusts the current year budget. I think that's an important thing I like to point out to people. In the Appropriations Act itself, you'll often see adjustments to the current year budget. And just, for the same reasons, right? If the budget adjustment passes in March, there's still sort of 2.5 more months or 3 more months of information that the General Assembly can use to kind of inform decision-making. And that often happens in the C section of the Appropriations Act. There's sort of letters throughout the Appropriations Act that markate different sections. So it's in the C section. A good example of this is last year, for those of you who were part of the General Assembly last year, you may recall a lot of times when we get to April is when the income tax receipts are sort of like, generally what the income tax receipts are going to be because everybody submits by April 15th. In April of last year, it became apparently clear that we were going to exceed the personal income tax receipts compared to forecast. So what the General Assembly did after that information was well known was adopt the contingent appropriation list. And what that did was say that we're probably going to have a bunch more revenue in the current fiscal year compared to the forecast. If that is the case come June 30th, then spend the money accordingly. And that became the contingent appropriation list. So a lot of times that will happen.
Raising my own hand. Is that included? Before you gave us that $172 million at the beginning. Is that after all the contingencies that were, okay.
Yeah.
So, and I don't know if this is that what we sort of sometimes refer to as waterfall?
Yep.
Okay.
Yes. And so the contingency list last year was about $114 million. And that was FY 2024 money, the money that came in before June 30th, 2024. The 172 is money that's anticipated between July 1 of 2024 and June 30 of 2025. And I keep forgetting to do this. I should back up. Fiscal years, right? We're on a June to July basis. One thing that's nice is when we're in session, the calendar year of the year we're in session matches the fiscal year. So we're in fiscal year 2025, and it is actually 2025. We're going to build the 2026 budget, which will go into effect on July 1st of 2025. That makes sense.
Okay. So those contingencies have been met. And there's still an additional 172 that has been collected through, like, say today, or when they
Forecasted through June 30th will be.
forecasted of this
Yeah.
in this fiscal year,
Yes.
or in fiscal year 24,
25.
25?
Yes.
Yeah, I messed up the dates already.
No worries. I do it all.
We're building the fiscal year 26 budget in a
Yes.
couple weeks. We'll get that.
Yes, you'll get that, I believe, on the 28th. is
Okay.
when that will arrive at the General Assembly. And that's all that I had. I can pull up those letters of intent if you want, or I can answer other questions first.
Leslie,
I'm just curious, is there sort of a standard percent that the BAA changes, compared to the base budget?
No. It
Would
depends.
there be a range? Could you give me an idea? I mean, I doubt it off the top of your head, I get it, but yeah, I'm just wondering, what percent are we now dealing with? This is what I'm wondering.
Right, so I think I'll have to get back to an actual on percentages. I typically don't do math in public.
You.
That's one of our JFO
Rules.
rules. But I will say I have seen, as I mentioned, I was doing some research, right, and looking back 10 years ago when I was in finance and management, right, it was $100 million in the other direction. This is like a bigger one than I've seen in terms of having the amount of revenue that's available. I think the total, the governor's proposed budget adjustment spends about $110 million, and then it sets aside about $87 million to carry forward into the FY26 budget. We don't know what the governor's going to propose to do with that $87 million. We'll find out next week, but that, I've seen very small budget adjustment, like $10 million. But it really depends on sort of what's going on, both from the revenue picture and what's happening with expenditures and what's happening in the economy. And
But even 87 million is pretty small compared to.
Yeah, 2 billion.
8.5 well,
of general fund.
Yeah.
Yes.
is that the right way to think about it? Or
Yeah.
not? Okay.
Lori? So I guess I didn't realize that the next year's budget isn't compared to BAA, but to the previous. So why, I don't know, I'm having trouble grasping that. So we're adding 172 million. Why would we not reflect that in that comparison?
Sure. So it's, to think about the best way to explain it. We think about the budget adjustment as like sort of one-time adjustments, right? Like the plane is flying and we got to tweak it a little bit.
Okay.
That's not to say that, adjustments that happen in the budget adjustment aren't going to show up again in 2026.
I got it. Okay.
Right? Like some things are just,
Yep.
but it's not. So Medicaid's a great example, right? There's a caseload and utilization tweak going to happen in the budget adjustment, but then it kind of gets restated
For next time. Okay.
for next time.
That makes sense. Thank you.
And it will probably include what is done in the budget adjustment.
Right.
But some of the things that we need to account for in the budget adjustment are one-time in
Time
nature,
things.
right? Either within Medicaid or anywhere in the budget.
Thank you. That's helpful.
now, you indicated at the beginning that you've seen years where, we've been short and that budget adjustment is about cutting. Do we have to cut? And conversely, if we've collected more money than we anticipated and we didn't appropriate it, can we just, what would we do to just hold it?
Correct.
Do we ever do that?
We did it last year in a way. So I'll take the sort of first piece of it. In terms of if there was a revenue downgrade, the budget needs to get back in balance with the forecasted revenue. So that's where the sort of cuts come in, is that if the emergency board adopted a reduction in the revenue forecast and there weren't associated expenditure changes, then the budget would be out of balance. Which Vermont is the only state that doesn't have a required balanced budget. Like in law, it's not required, but I would imagine that everybody wants the budget to be back in balance, which is why if there's a revenue downgrade, adjustments are made accordingly. And it's not, sometimes it's cuts, but other times it's, there's timing of projects or something that sort of gets everything back in line, but maybe pushes stuff out to get dealt with in the next budget year. And it's, it's hard when those revenue downgrades come in January. because you don't have a lot of time, things are going, you don't have a lot of time to adjust stuff. So you have to get, not creative's not the best answer, but you have to sort of figure that out accordingly. The second one, in terms of if there was extra revenue that came in, you don't have to spend it, right? So there are sort of two pieces of it. There's the in statute, if there's more revenue collected, if there's revenue collected over and above what's appropriated and part of the revenue forecast. In statute, what happens to any of that revenue? It goes to 50% of it goes to the general fund, rainy day fund, the balance reserve. There's two general fund reserves, stabilization reserve and the balance reserve. It goes to the balance reserve. So at the end of last fiscal year, despite having $114 million worth of contingent appropriations, and there was more than $114 million, the revenue did better than we thought it did when the budget passed. So about $17 million went into that reserve at the end of the fiscal year. And then the other 50% gets split 50-50 between the teacher's pension and the state employees' pension funds. So there was about $8 million that went into each of those funds at the end of last fiscal year, over and above the contingent appropriations. But the General Assembly, if you didn't act, if there looked like there was going to be additional revenue, you didn't do anything, then the statutory allocation of those funds would occur. You could also, and so what happens, the way that contingency list comes into fruition is that the General Assembly notwithstands that allocation and says, instead of that, do this with it. What's been presented in the budget adjustment by the executive branch this year, who I talked about, there's about $87 million on the bottom line of the governor's budget adjustment to be carried forward into next year. They've included proposed language in the budget adjustment that says, when we get to the end of the fiscal year, any money that hasn't been appropriated or allocated over and above what hasn't been appropriated, notwithstand the statutory language, and carry all of it into next year, which is something the General Assembly can concur with or not, depending, but that's sort of the other option in terms of what to do with those funds on an annual basis. And I've sort of seen all of it. It just kind of depends on what you know come April in terms of how things are performing. And if it doesn't meet the forecast, then you have to go through a rescission process. But that's a whole other thing for a whole different day, and we are nowhere near that.
Do you want to show us the letter of intent?
Yeah, sure. So I think you have to. Sure, right, okay. So, and this is the first letter. Oh no, this is the first one. Yeah, this is the first one signed right before the beginning of the fiscal year by the former chairs of the appropriations committees. And just a good example of one. That first one, a digit got left out in the ADS appropriation. There was actually supposed to be a reduction of $873 million, and we only reduced it by $87,000. So this was to acknowledge that, yes, you can't, and that's an adjustment you can't make after the fact, right? The General Assembly passed an appropriation that is this number. That's not a Scribner's error. That is the law. So this was acknowledging that, like, the intent was not to drop the digit. The intent was to reduce it by $873 million. So that's in the governor's recommended budget adjustment, right? And it's a lot of times this signals that, like, dear governor, please put this in your budget adjustment recommendation. This the contingent appropriations one. This was just there was a question that came through that was, in the event that there wasn't the full $114 million available, was it the intent of the General Assembly to go through the list and fully fund and then stop once the money was exhausted? Or was it the intent that everything to prorate everything on the contingency list per the amount of money available? And the intent was fund it, go down the list. When you get to the end, partially fund whatever the last thing that can be funded on the list. That was that one. This one about the judge, the intent was it be funded with the tobacco litigation money. until that money has been exhausted, and then in the budget, come up with another source for funds for those. This one's more Human Services Committee, but the Child Welfare Information System, reverted some unobligated spending at the Agency of Human Services. The intent was that it go back into their budget in the next year. This one may be more this committee, the designated agencies and specialized services rate increase that was in the budget last year. This was to make it clear that the intent was not that that money be specifically for raises for employees, that it was a 3% increase to those entities to acknowledge that sort of all costs had gone up, and that it was the intent that the designated agencies and the specialized services agencies figure out the best way to allocate that additional funding, either to salaries or to sort of other, administrative costs that are also subject to inflationary pressures. And then the next chunk, I don't know if you want me to walk through any of these, because this is all property transfer tax related to Act 181.
I think just an example of what it actually is.
Perfect. The other one, actually, I'll show you the other one, because I think that one might be more in your jurisdiction. It's related to the funding for the opioid treatment. So yeah, this one was issued later in July. And this one, it's easier to actually show the language on this one. But in the budget, there was money from the opioid abatement special fund that was appropriated. There was 1.5 million that was supposed to be equally divided between 3 centers. And then there was a second subsection that dedicated $500,000 to a location operated by the Howard Center. And this was to make it clear that the intent was a total of $2 million split between 4 entities, and not that the Howard Center, which was in the sort of subpart 2, was that the first 1.5 wasn't supposed to get divided by 4, and they were supposed to get $500,000 plus their share of the first 1.5, but it was a total of 2 across 4, and everybody got $500,000. So that was to make that clear for the health department. But I think that's everything that's in the letters of intent, budget adjustment. Happy to answer other questions if there are any.
I have a couple questions if nobody else does. So we're going to be having some of the agencies that we have jurisdiction over in, and I know that they always come in with their budget with all the lines on it. And then they come in with their narrative, which I always think is the ups and the downs, maybe. I was sort of hoping that maybe you could show us a budget, how to read it, what we're looking for. And I always find it pretty confusing. I don't know about anybody else, but I'm never quite
For my
sure.
questions.
You're
So over my questions. Oh, I was just going right there.
I was just like, maybe if we could bring up even divas, and we don't have to, but when they come in here, show us how we read that, or tell us how we read it.
And is,
No, go ahead.
and is the ups and downs approach the best way of understanding it? Because I struggle with the ups and downs. Because it doesn't seem like it's a whole, or I'm not sure how to.
Sure. I can do my best.
It seems obscure. I mean, I can't understand that. I haven't been able to so far.
Sure. And so it's not my document, right? But I can give you a general. So this is the front page, right, of the ups and downs. And so we've got the funds across the top, and this is what was passed in the big bill. You can ignore this one. And so this is the same thing. This is the as passed human services budget. And in this next box, these are an aggregate of all of the changes by department within the agency. So for example, the central office has a total $129 million budget adjustment request across the general fund.
Oh, you're looking over there.
Yeah, all over here is where so you get the total for each department. And then it sort of aggregates across for each funding stream. This is just sort of at the high level. This doesn't give you any of the details, but you can see the, $64 million change in DEVA and the $55 million change of global commitment funds in Dale for the long-term care needs. And then over here in the central office, this includes the mixing bowl appropriation. So that's why that one is 46 million and the federal funds is 75 million, because that's where you see the federal funds coming in for Medicaid and the state match for Medicaid for those programs. It might be better to go down to. And right, so this is what the governor has recommended for the total budget adjustment. So it's going from $5.3 billion of all funds, including the duplicated Medicaid Global Commitment Fund, to about 5.6 is his proposed budget adjustment for the agency. And Nolan's talked to you about the duplicated fund thing. I can talk about it quickly again.
It's been a while.
Sure. So I will suggest having Nolan meet and talk about duplicated funds, but right, Medicaid requires a state match. So you have the state funds for Medicaid and then you have federal funds for Medicaid. And what we sort of do, we call it the mixing bowl, right? So we appropriate the general fund and the federal fund, and then it goes into the global commitment fund. And then we appropriate it out of the global commitment fund again. So in effect, you're sort of appropriating it once when you do the match, and then again when you do the programmatic spend, which makes it duplicative. So a lot of times on the sort of like big documents around the budget, you'll see duplicated funds, which is the spending authority that's happening sometimes twice, and then the non-duplicated funds, which is like the actual total dollars that will get spent.
So if I'm looking like at Divas right now, at their,
If I go
at
down,
the bottom of their page. So it has the governor recommend, the BAA governor recommend starting at 1.18 billion. And then it has the BAA total is past 1.25. So essentially, is that the difference between the?
yeah, so the budget was 1.18. That's
Yes.
this one. They are asking for an additional $69 million worth of spending authority. That's this one.
Okay,
And then the 1.25 is what the sort of total new budget adjustment would be.
okay,
If and when either the House or the Senate make changes to that, it will show up in this zero line at the bottom, and then you'll get a new total for the FY25
okay.
BAA total as passed. So in a way to look at this, so at the top, this line, this top line is the as passed FY25 budget, so that should match. And it's a little tricky. If you were to add, because DEVA's got 4 appropriations, I think if you add 34.9 plus 63, all these ones in black, plus the 900 plus 182 will get you to this bottom line number, this 1.18. So on the top, the green part is the as passed budget. You can kind of ignore the yellow pieces. Occasionally, if there is a rescission, that's where that information would show up because it's sort of an off cycle incident. If the emergency board had to do something, that would show up there, but none of that happened in human services. You can ignore the yellow stuff. So these numbers will all match what's above. And then all of the changes are going to show up in this white section. And that should match. If you added up all the changes, it'll match this row that totals to $69 million. But what they're saying with this is they're saying, so we'll use the DEVA non-Medicaid matched non-waiver expenses. So caseload and utilization is projected to increase. The general fund share is $1 million. The federal fund share is 2.4 for a total caseload and utilization change in those programs of $3.4 million. An important question to ask you was like, which programs is that exactly? And sort of what are those changes? And then same thing with this sort of blueprint and pregnant individuals initiative adjustment, right? So they are reducing general fund by 56 million. They're reducing federal funds by 136. And that sort of total reduction for that line item is $192,000.
So they need more of one, they don't need as much of the other.
Yes.
Okay.
And those two line items, those two line items will add to that sort of first orange line, the 947.
Mhm.
Then you add the 947 to the 12 up above, and that gets you the new number, the new $13.4 million.
Okay,
Um,
there. Leslie?
This question may be unanswerable from your point of view, but I'm curious to know if you were sitting in this seat, what questions would you ask looking at this?
That may be an unanswerable question.
Because I don't really know how to approach it. And that's what I'm just thinking about, because it's a lot of numbers. I don't have a mathematical head to put it together. So like you made a comment about what changed in something went up. I can't remember what.
Yeah, this caseload and
Yeah,
utilization.
that's that. So yeah, so that's obvious, but it flies by so fast and it's
Mhm.
just really hard for me to get my head around it.
If I can just make a
Yeah, of
recommendation,
course.
I think the key for some of the stuff that we deal with is really the written document they
Mhm.
also give us that breaks it out by
Oh, I remember,
section.
yeah, that thing, yeah.
This, if you can follow it, but some people aren't really great with numbers and lines. But that is like the bulk.
Then it's
of-
more of a discussion,
Yeah.
narrative of the program, yeah, yeah.
Exactly.
And I mean, I recall going through the narrative last year as they were testifying and I was marking, it was very clear that there are things that we just can't change. I mean, we can't change the utilization. We can ask questions about why we think it's off, why we think people are using, but the number is the number. And so I've always sort of found it helpful as we're going through the narrative of this is something we have to do. I mean, if I recall, there's a lot that we have that's federally mandated that we have to spend a certain amount, so therefore they have to make the adjustment and we have no choice. But I think we'll get into that when we.
Yeah, so maybe the goal is understanding, basically, because we can't change numbers.
Yeah.
That's sort of, those are the numbers.
Thank you. This was really helpful. I know for me it was. This has always been a bit of an enigma.
Yeah, it's a little bit of a dark.
Thanks so much. And we are gonna go off live because we have to change our location here.